Today, we're diving into a concept that sounds like it's straight out of science fiction, but could, one day, completely change medicine as we know it. It's called the Neuroselective Reversible Consciousness Switch, or NSRC. Basically, it's a whole new vision for anesthesia that swaps out drugs for precision neural engineering.
So let me ask you this. What if you can have a major surgery and the second it's done, you just wake up? I'm not talking about that slow, groggy, sometimes nauseous feeling. I mean instantly awake, clear-headed, totally calm. That is the incredible promise of the technology we're looking at today.
To really get a handle on just how huge this would be, let's do a little time traveling. We're going to jump forward to the year 2048 and watch a hypothetical first-ever surgery using this exact system.
So take a look at this operating room of the future. The first thing that probably jumps out at you is what's missing, right? All those bulky anesthesia machines, the drug pumps, the vaporizers, they're just gone. Instead, there's this sleek little system. And the anesthesiologist's job? Well, it's totally different. They've gone from a drug calculator to a neural engineer, fine-tuning the brain itself.
Here's the play-by-play of how that first procedure goes down. Before anything even starts, the patient's brain is precisely mapped. Then, at 9 a.m., boom, the system is turned on. And here's the most important part, 0 drugs are used. None. When the surgeon's done, the signal is just turned off.
And the result? It's just astonishing. The patient is awake immediately. They're calm, they know where they are, and they have no memory of the surgery. Think about that. Recovery isn't this long, slow process anymore. It's an instant return to normal. Okay. To really appreciate why that vision is so game-changing, we have to talk about how anesthesia works today. You know, modern anesthesia is a true medical marvel. It's all about achieving 3 main goals, this triad as they call it. You've got to relieve pain, make sure the patient is unconscious, and relax their muscles so the surgeon can work. This combination is literally what makes all of today's complex surgeries possible. But here's the catch. We do all of this using really powerful drugs that go systemic, meaning they affect your entire body. They basically put a damper on your whole central nervous system, and that can mess with your breathing, your blood pressure, everything. It works, for sure, but it's a bit of a blunt instrument. And you can really see the difference when you put them side by side. On one hand, you have today's approach, systemic drugs, slow recovery based on how fast your body can process everything. On the other hand, you have the NRCS concept, targeted, precise control for instant recovery with way fewer side effects, because you're not flooding the whole body. It's a completely different way of thinking. So the big question is, how would this consciousness switch actually work? Let's dig into the core idea. The system really boils down to 2 main pieces. First, you'd have a tiny microscopic implant that targets the exact parts of the brain responsible for being awake and aware. And second, there's an external console that wirelessly talks to that implant, essentially giving it the command to turn consciousness on or off. And honestly, this is the best way to think about it. Instead of a single knockout drug that puts the whole body to sleep, this tech would let an anesthesiologist fine-tune your level of awareness, kind of like you'd use a dimmer switch to adjust the lights in a room. Let's use another analogy to really nail this down. Today's pharmacology is like a giant floodlight that dims your entire house. It affects every single system. The NRCS, though, that's like a light switch for just one room. It targets only the consciousness circuits and leaves everything else alone. Now, I know this all sounds incredible, but you might be thinking, what technology could actually make this happen? Well, the cool part is that this vision is built on real-world science that's happening right now. So the whole system really has 3 main jobs. First, you have that tiny neural implant that's placed just right to interact with the brain's consciousness networks. Second, an external machine sends a wireless signal to that implant. And third, that signal temporarily and, this is key, reversibly quiets down those brain circuits for as long as the surgery takes. And look, this isn't just theory. The building blocks for this are already being developed. Researchers are hard at work on things like focused ultrasound and electromagnetic modulation, ways to interact with the brain without invasive surgery. The NRCS idea is a direct extension of these very real, cutting-edge fields. But, if we could actually master a technology like this, the implications would go way, way beyond the operating room. It could kickstart a whole new chapter in how we understand awareness itself. I mean, think about it. This isn't just about better anesthesia. A tool that lets you safely turn consciousness on and off would be a complete game changer for neuroscience. We could study the brain like never before. It could totally transform how we manage comas in the ICU and maybe even open the door to brand new treatments for neurological and psychiatric disorders.
And that brings us to the final, really big question. Being able to precisely control the circuits of awareness would be one of the greatest achievements in medical history, no doubt. But it also opens up a huge new door in understanding the human mind. If we can truly turn consciousness on and off like a light switch, what does that teach us about the very nature of who we are?